Topic for today's didactic is sexual violence, guiding principles and challenges in managing trauma. So first let's understand what are the learning objectives of this didactic. The first learning objective is understanding trauma reactions. That will consist of understanding the immediate psychological reactions related to trauma caused by sexual assault, secondary trauma from police and the court procedures, long-term psychological issues related to trauma from sexual assault or sexual violence, psychological reactions related to marital rape, and factors that increase or decrease the trauma. Second, we would be talking about child sexual abuse, where we will understand the nature and types of child sexual abuse, warning signs to look for in children experiencing the sexual abuse, and lastly, primary guidelines for handling CSA. Third learning objective for today's didactic would be counseling to reduce trauma. So we need to understand how to educate the woman about the possible reactions on trauma resulting from the sexual violence, and also how to manage reactions to various triggers. Lastly, we will talk about the referral to a mental health professional of a woman who have experienced sexual violence. So there we'll talk about when to refer, to whom do we refer, how to refer, and how will the treatment or the referral help. So first, let's understand what sexual violence is. Sexual violence is any sexual act, attempt to obtain a sexual act or unwanted sexual comments or advances. That could be by any person, regardless of their relationship to the victim, in any setting, including home and work. So where there is no consent of the person, where an individual or a group of individuals is attempting to obtain a sexual act or performing a sexual act in any setting would entail as sexual violence. So let's understand what are the various types of sexual violence. It could be coercive penetration of vagina, anus, or mouth. It could be attempted penetration, drug-facilitated sexual violence, threats of sexual violence, unwanted sexual advances, sexual harassment, incest, sexual intercourse without the spouse's consent, and also child sexual abuse. So we will be talking about these various types of sexual violence in details now. So, but before that, we will talk about what people think about rape. So these are for, some of the statements where we want to know from you whether you agree with the statements as true or as false. So these statements are: women or children wearing short dresses, sleeveless, or not taking a dupatta provoke men to behave badly. Another common statement would be: why did she not scream and shout for help when she was being sexually assaulted? She was raped because she went out alone at night, so it was her fault. Or related to child sexual abuse, children can forget about the assault and can get over it with time. So what do you think? Are these statements true or false? Another set of statements would be: once a woman gives consent for kissing or touching her breast, she cannot object if the man does more. Or if he did not touch you and he only said sexual things, it is not actually abuse. Or maybe a statement like: married women can never say that their husband raped them. Or an adult can show their love by kissing or touching a child's genitals. And lastly, sex workers cannot complain of being raped because it's their job. So again, we would like to know from you, what do you think? Are these statements true or false? Now let's understand psychological responses to trauma due to sexual violence. So that we will try to understand with the case of Miss S. So Miss S, who's 27-year-old, works in a bank. She came early in the morning to work, and a co-worker had tried to kiss her and touch her when they were alone without her consent. She was shocked and felt dirty. When others came at 9 a.m., she could not greet anyone or smile, and she didn't feel like speaking to anyone. She quietly walked to her desk and kept staring at her desktop, and she couldn't even work. She told a female colleague about what happened, who made a statement like, "But you looked so calm this morning, and it doesn't look like you would have gone through such a terrible and scary experience." So here in this slide, we are trying to understand what is the immediate response of a woman who have experienced sexual assault. So as you can see that she felt, she was shocked and she felt dirty. She couldn't greet anyone or smile the way she would do otherwise on other days. She tried to focus on work, but she couldn't work. She quietly sat in front of her desktop, kept staring at it, etc. So this is like one type of immediate response that we can see in a woman who have experienced sexual violence. There could be various other ways a woman reacts to the same situation. Moving next is to secondary victimization response. So Miss S, with a lot of difficulty, finally manages to discuss with her colleague and her elder sister about the incident that happened in the office in detail. They suggested that she should complain to the official authority and the police. So the next day, while reporting to the HR and manager and then to the police, Miss S burst out crying. She was shaking and was very anxious. The more questions were asked, the more she became uncomfortable and quiet. She started breathing heavily and started feeling dizzy. After some time, she fainted, and this happened every time she spoke to the office lawyer and also at the medical examination. So here we can understand that the incident has happened with Miss S in the office, but however, later when she's reporting it to the HR and the manager or the police or going for the medical examination, which is a part of the investigation and etc. So in this entire process, she's being asked a lot of questions, which is the usual procedure. So as a result of which, a lot of women during this process feels traumatized for the second time or keeps getting traumatized repeatedly because the person has to go through or narrate the same incident over and over again, which is known as secondary victimization response, which is also a very strong response or a strong traumatic response to a sexual violence act. Lastly, we will try to understand a long-term response to sexual violence. Here we will be presenting to you a response of PTSD, which in other women, in other cases, could be manifested in other ways as well. For instance, we will talk here about PTSD. So Miss S, now who is 31 years old, is a housewife. She has difficulty feeling happy or excited. She tries hard to forget the incident that happened 4 years ago, but fails as the memories keep flashing in front of her. Whenever she sees a man in a blue shirt or standing close to her and talking, she freezes and starts sweating. She gets so frightened that she keeps her doors and windows locked. At night, she wakes up trembling. She dreams of her being attacked. She avoids watching crime scenes or fights on TV. When her husband tries to be intimate with her, she freezes and feels like stone with no feeling. So it's been 4 years, which we can understand. It's a long-term traumatic response that Miss S is experiencing, where even though the incident has happened 4 years back, she's still not out of it. And she is having a lot of changes in her life where she can't get back to her normal life, how it was earlier. And she's experiencing a lot of symptoms related to her mental health, which we can understand as PTSD response. Now let's understand and talk a little about marital rape and the trauma reactions related to it. So what is marital rape? Marital rape is the act of sexual intercourse with one's spouse without the spouse's consent. It is not considered a criminal act in India, unlike rape. Women suffering from marital rape often report of being beaten or abused by her husband, along with the sexual assault. Marital rape often goes underreported and unreported. Why? We will talk about it. So most women fail to report marital rape as it is socially tolerated. People do not believe the experience of the woman. Some abused women are also afraid to report the violence because they rely financially on their husbands for their upkeep and the children's maintenance. So even though a woman is experiencing marital rape, she chooses not to report it due to the financial dependence. Or a lot of times the woman reaches out to their family where the family members don't believe it or talks about it, is that that's a part of the marriage. How is that rape? It's with your husband. Okay, so a lot of times women also feel unable to speak due to the fear and humiliation. And also a lot of women continues to experience marital rape with the belief that also comes a lot of times from the family, that it's their wifely duty to perform the sexual act, even though they are not consenting for it when asked by their husband. Okay. So we'll try to understand the concept of marital rape with the case Vinay. So this is Sunita, who's 26 years old. She's married for the last 3 years. Soon after a year of her marriage, Sunita got pregnant, but she was not happy about it. Sunita tells her mother that I get angry when I see him. He used to force me. I shouldn't have married him. He has made my life miserable. So the mother tells Sunita that he's your husband. It's your wifely duty to satisfy him and you cannot leave him. So listening to this, Sunita feels devastated. Sunita has been visiting a gynecologist for her pregnancy. The gynecologist notices that she is not happy with the pregnancy and she tells Sunita, if you want to share anything, please feel comfortable and say it will remain confidential. Sunita felt little hopeful and she shares that her husband used to beat her and abuse her. He used to force for sexual relations every night, even though she would not she would say no repeatedly and report pain. He would not listen. So here we can understand it's a clear case where Sunita is not consenting. She is experiencing pain and yet she is being forced for the sexual relationships where it is also accompanied by physical abuse by her husband. This has resulted in a pregnancy, which also again Sunita is not happy about because she for her reasons that she feels that her husband, she's not happy with her husband, she's being violated. So she reaches out to her mother also doesn't believe it, she doesn't validate it, and as a result of which, she continues with this, right? So now let's understand what is dissociation and flashback. So dissociation and flashback are certain psychological reactions that are very common in trauma reactions related to sexual violence. So first we'll talk about dissociation. Dissociation is a state where you kind of have a blurred or a distorted sense of reality. You will be unable to remember things for some time. You will feel a blankness. There can be loss of memories about specific people, places, information, events, or specific periods, maybe related to the incident of sexual violence, where it happened, by whom it was perpetrated. So the person can completely dissociate from that memory. It can also be accompanied by a feeling of numbness and disconnection, a distorted sense of place and time, and also a feeling of detachment from one's emotions. Dissociation also accompanied by experience of flashbacks of traumatic events. Now we'll talk about what flashback is. So flashbacks are distressing memory of the trauma, where the unwanted or the intrusive images of the traumatic memory of the sexual violence of the act keeps coming back to the person. As a result, the person or the woman feels like she's reliving the trauma as if it is happening right now. So it kind of takes over all the senses, okay? So flashback and dissociation often goes hand in hand. So now we'll try to summarize whatever we discussed under the first learning objectives. That is the psychological reaction related to the trauma resulting from sexual violence. So what are the immediate psychological reactions and the later psychological reactions? So trying to summarize it, immediate psychological reactions could be blaming oneself or experiencing guilt, feeling numb, being confused about what happened and being disoriented, feeling frightened, feeling angry, ashamed, or being in a state of daze. What are the later psychological reactions? Memories of the incidents flashing up, living in constant fear, isolating oneself, sudden palpitation, sweating, and other anxiety symptoms, loss of trust, inability to concentrate on work or studies. Now we'll move on to the second learning objective, that is trying to understand what is child sexual abuse. So child sexual abuse is any sexual activity with a child under age 18 by an adult or an adolescent. So an interaction between a child and an adult where the child is used for any kind of sexual stimulation would qualify as child sexual abuse. So these acts can include sexual touching, genital touching, non-genital touching, and non-contact behavior as well. So we'll understand what are the various types of child sexual abuse. So as I was saying, it could be contact abuse where the perpetrator is touching the intimate part of the child or otherwise. Okay, non-contact abuse. So here the perpetrator may be making offensive sexual remarks, observing the child while undressing, making the child watch pornography or certain scenes. Genital abuse, where the perpetrator is touching and fondling with the genitals of the child. Non-genital abuse would be touching and fondling body parts of the child other than the genitals. Okay. Penetrative abuse is also comes under child sexual abuse, where the perpetrator is using the penis or other objects to penetrate any body part of the child. So it could be the anus, it could be mouth, it could be a vagina or vulva of the child. So if the perpetrator is trying to penetrate the penis or any other objects or fingers in this body parts of the child, that also will qualify as penetrative child sexual abuse. Along with these various types of child sexual abuse, there is also a concept of grooming that we need to understand. So grooming is a method of manipulation that entails a process of engaging the child in sexual acts. So this could be like giving gifts to the child, or making a child, like praising the child repeatedly, or trying to establish a special relationship with the child, saying things like, this is our secret play, this is to make you become a good girl, and this should remain our secret, or like in some way or the other gaining the trust of the child, and then you making inappropriate sexual acts with the child. That would qualify as grooming. Very important here is to understand what are the warning signs that we have to look for in children. So first we will be looking for in younger children. So when we see these particular signs, we have to be very cautious that there may have been a child sexual abuse that this child has experienced. So what could be some of these warning signs? One could be sexualized behavior. So here we can find a child rubbing or touching his or her own genitals, or touching other people of the family or others or friends inappropriately. That could be one of the warning signs. Avoidance of very specific adults, maybe a particular teacher, a family member, or a friend, or whatever, or a senior person. Avoidance of specific adults. Nightmares or sleep disturbances. Clingy behavior or separation anxiety. So if the child was always clingy, that's different. But suddenly, if there is a change in the behavior where we notice that the child has suddenly become very clingy to the mother or the father and is scared to go out, meet anybody, that is a very strong warning sign. Fearfulness and anxiety, bedwetting, school refusal, it has to be taken very seriously. Decreased scholastic performance. So if the child was performing well and there is a marked change in the child's school performance, that's also another very strong warning sign. And medically unexplained body aches, pains, bruises is also something we need to be careful about. In older children or adolescents, some of the warning signs could be self-harm, depression or isolation. So the child, the adolescent or the older child is isolating oneself from his or her friends group, or cousins or siblings, not mixing up with people. Anger, fearfulness and anxiety, sleep disturbances, nightmares, flashbacks, avoidance of specific adults, school refusal, decreased scholastic performance. So these are all the same as the younger children as well. Another different for older children or adolescents would be engaging in high risk behaviors, that is sudden sexual behavior, they trying to attempt sexual acts onto others, substance use or running away. So when do we suspect child sexual abuse? Definitely when a child is reporting or disclosing abuse, we need to trust the child, believe the child. Second is if we find pregnancy in an adolescent girl. If there are unexplained medically unexplained bruises, pains, etc., or genital injuries or urinary infections, and also if there is very significant emotional or behavioral changes in the child that we notice. So that should increase our suspicion for child sexual abuse. Now, when we find child sexual abuse, what are the things that we need to do? So what are the primary response after finding out CSA? It is mandatory to report to the Child Welfare Committee, that is CWC, or to the police. Guiding and supporting the family, that could be the parents or the primary caregiver, through medical and the legal processes, the way it is required. First level or emergency response with the child, where we need to provide the child psychological first aid. We have to listen to the child intently. We have to validate the child's emotions. We have to ensure the safety of the child, and we have to provide all the possible support to the child in a very empathetic way. Necessary referrals to be made. So depending on what are the how is the child sexual abuse, the Sexual Abuse Act has impacted the child. Accordingly, we have to make reference. We have to ensure the child's safety so that the same act doesn't get repeated again. So in that case, we have to interact with the parents, try to prepare them. We have to prepare the parents also to respond to the child's queries and confusions, because a lot of times, even though the child experiences sexual abuse, he or she understands that it is something untoward and not pleasant, but the child doesn't have a very good clarity of what exactly happened. We need to address that. We need to prepare the child so that the child doesn't experience anything again in future. So we have to answer the queries and confusions, but in a way that the child understands and in a very empathetic and supportive way, to discuss with child's parents in a sensitive and gentle manner. Now let's understand what are the factors that influence psychological distress related to sexual assault. So some of the factors that will impact the psychological distress the woman or person is experiencing due to sexual assault is if the sexual assault was accompanied by physical violence, if there was threat to life to the woman, if the woman was drugged during or before the act, if a person was with her was threatened or harmed, if the rape was done by one person or more than one person. Okay, so if it was a grand rape, so that kind of influences the severity of the psychological distress. And also assaulted by a known person, so it could be in marital rape, how by husband it happens, or in child sexual abuse, how commonly we find children being assaulted or the sexual violence being perpetrated by family members. In most of the cases, it's the known person who perpetrates this act to the child. So that kind of increases or influences the severity of the psychological distress. On the other hand, some of the factors that can influence the severity of the psychological distress in a positive way. So if there is the family and the friends are being very supportive, if the school, college, or the workplace understands the situation of the woman and gives the woman time off, if the person has a provision of receiving proper counseling services, if the person is not being blamed, not being discriminated, that can definitely reduce the severity of the psychological distress. On the other hand, some of the other factors that affects the severity of psychological distress is perpetrator issues. So if the person is working in the same place as the perpetrator, or if the perpetrator is out on bail, so this all could add to the distress and can trigger the trauma again. Media trial or the sensitivity within the system, where we were talking about secondary victimization. So if the health system, police system, legal system, they are not very sensitive and they're constantly inquiring and questioning the woman, that can add to the psychological distress that the woman is experiencing. Other factors that influence the severity of psychological distress would include past experience of traumatic events, childhood sexual abuse, history of psychological problem. If the person is already experiencing some mental health problems such as depression or anxiety, abuse by relatives or known person, abusive family, that the family is not being supportive, rather is being abusive, homelessness, physical or sensory disabilities, and intellectual disability that can add to the psychological distress that the person is experiencing. So we'll quickly talk about the protective factors and the vulnerable factors that contributes to the psychological distress that the woman is experiencing as a result of the sexual violence that she has experienced. So the protective factors could be support from family, relatives, workplace, colleagues, school, college, friends, everybody. Help with work or studies, trauma counseling. So the person has a provision of counseling. And the vulnerable factors would include re-traumatizing experiences, history of abuse or psychological problem, abused in childhood in whatever forms, media and systems faulty way of handling the case, which increases the secondary victimization process, and lack of adequate support from closed ones. Now we'll pause a little to understand the concept of importance of consent or partial consent through a testimony video. Now, moving to the third learning objective of the didactic is understanding the counseling that we need to provide to a woman who has experienced sexual assault or violence. So the first thing that we need to provide to the woman is psychological first aid. So to provide psychological first aid, the model that we use most commonly is the LIVES model given by World Health Organization. So the LIVES model is an acronym where L stands for listening patiently, where we will not try to interrupt the woman. We will understand her silence when she is talking to us. We will not push her to give all the details. We will just listen to as much details the woman is sharing with us about that particular incident. I stands for inquiring about her physical and emotional health. Also, inquiring about her needs, why she has reached out to us, what are the ways that we can help the woman in. So maybe the woman wants medical assistance, maybe the woman wants just counseling, she may be wanting legal aid. So accordingly, we need to identify what the woman's needs are and accordingly help her out. So we have to inquire about her current state, her current emotional, physical, mental status, and also the needs that she has. V stands for validating her responses, believing in what she's saying, believing in her trauma reactions, believing in her decisions and her choices that she makes, and supporting her in that. E would stand for ensuring her safety and confidentiality, so that the woman feels a safe space, and that would also help us moving to the next one, that is the S, that is supporting her throughout the procedure and providing links to support system. So basically facilitating social support for her where she feels safe. So maybe connecting her to her family members, her relatives, her friends with whom she feels safe and also supported. Next would be, what is the counseling that we can provide to reduce secondary trauma? So that would include assuring the survivor that the assault was not her fault, giving her a sense of control and agency, for example, where she decides whether she wants to file a case or whether she wants to inform somebody. And whatever be the choice of the woman, and the decision of the woman, we have to support. We must support the woman in that. Providing her with the freedom to step out of the procedure anytime she wants to. So for example, if a woman has made a decision that she wants to report the incident to the police, and so while during the process, she decides that she doesn't want to continue with it and she wants to step out of it, we need to also inform the woman that she has the choice of this and she has the freedom of this and she can choose to step out of it. We also have to assure the woman that the consent would be sought before introducing any therapeutic technique, and everything will be done with mutual agreement. And also getting permission before providing information to friends or family members, and we'll not do that unless she gives consent. So if the woman doesn't want to talk about this incident or want any of our family members or friends to be informed about it, so we will not do that and we'll keep the entire information confidential. So this way will help the woman not experience further trauma or re-traumatization. Now let's understand how to manage the flashbacks or the reactions to the triggers, right? So previously we were talking about the triggers where suppose the woman is working in the same workplace as the perpetrator, or the person is a known person, is a family member, is a stranger, not a stranger. So in those cases, the triggers are a lot and the woman may experience flashback and other reactions. So how do we help a woman in reducing those? So there we would first identify the internal or the external stimulus, which is acting as a trigger, okay? So we have to identify what was the time and the day, what was happening around the woman at that point of time, what was she doing at that time, where was she, and any particular thing that she was noticing. So it could be a particular person, a color. So basically understanding what is the trigger that kind of made her experience flashback or dissociation or other psychological reactions, okay? And once we have identified, will be in a better place to help the woman using a lot of psychological intervention, basic psychological intervention strategies, and through our counseling, about which we will talk in another tactic. But after this, what we'll talk about is referral to the mental health services. So we first need to understand, when do we refer a woman who have experienced sexual violence? So when there is a risk of self-harm, when there is depression, the woman has, after this sexual assault or the sexual violence, she has experienced depression, the depression is so severe that is interfering with the day-to-day activities of the woman. Okay, there is severe flashbacks, nightmares, anxiety, or other symptoms of PTSD. There is psychological distress that is persisting despite you providing maybe some few sessions of counseling, and there has been no change or the situation is worsening. If there is psychosis or severe mental illness present in the woman, if the survivor or the woman who have experienced sexual violence has become pregnant due to the act and or has gone through a medically terminated pregnancy, and persons with intellectual disability. To whom do we refer? We can refer the person to a psychiatrist. If it's a child sexual abuse case, we can refer to the child psychiatrist, clinical psychologist or a child psychologist, occupational therapist, special educators, speech therapist, psychiatric social worker, counselors, district mental health program, or primary care doctor, as per the need. So if we see that there is a chance of self-harm or suicide, so we probably need to refer the person to the psychiatrist first because there is a need for medication. If the symptoms of PTSD or depression is so severe and it's interfering with the general functioning of that individual, we need to also start proper therapy for that individual. So accordingly, we need to refer the person to the child psychologist and also to the psychiatric social worker. If it's a child who has started, there has been changes in the child's academic performance, then in that case, we may need to refer the child to the special educators. And so as per the need, we have to make these referrals. So how do we make a referral? We have to first set up an appointment. We must call the mental health professional whom we are referring the person to and brief them about the case. So a very good way to do this would be making a referral letter where we can mention that this is the person of this age who I am referring to you for these problems, and I would request you to provide the necessary evaluation and intervention. So this will help in a way where the woman, again, when she goes to this person whom you have referred to, she doesn't require to narrate the entire situation, and the person can take up the case right from there. So that will help in reducing the secondary victimization to a great extent. We need to also follow up after the referral. We have to give the feedback to the survivor and also ensure careful documentation. So why we are referring, to whom we are referring, and what is the feedback from the referral. The entire procedure needs to be documented. Now, how will this treatment help, or why is this referral important? Because that will help in managing the symptoms, improving the mental health status, improving the day-to-day functioning, improving relationships among couples or family members, and also in helping in reducing the secondary trauma and anxiety related to evidence and procedures. Lastly, we'll talk about attempt in creating inclusive services and tailoring it for persons with specific needs. So who comes under the special groups or people with specific needs? Sex workers, LGBTQI plus communities, persons with disability, or people facing caste, class, religion, or any other types of discrimination. So some of the guiding principles we need to keep in mind while providing services to people from these special groups. We must not make any assumptions and look at our own biases very carefully. We must show cultural sensitivity and enable survivors to feel at ease. We must acknowledge challenges and provide an enabling environment. We must not show disbelief, ridicule, bias, judgmental, and discriminative behavior in any of the way through our body language or by making certain explicit comments. We have to be very careful of their confidentiality, of their orientation, work, their identity, etc. So this was the presentation on this didactic of providing support to women facing sexual violence. Thank you.